Thank you, Chair. Morning, Minister. Morning, Secretary. I want to go back to community palliative care. And given that there's been no increase in funding, what advice have you received in relation to the expected increase in demand within the acute healthcare settings? Or in other words, how many people are going to die in hospital rather than be able to die at home because there's not enough funding to meet demand of people wishing to have community palliative care and die at home?
And which budget paper are you referring to?
Sorry, we're on non-admitted services. It's page 65 of the Department Performance Statement.
Ms Benham, can I just start by, thanking you for the question. Let's be clear. This year we are investing $31 billion into our health service system, and that is a record amount of funding, and our health services use that funding in order to meet the needs of their communities. And again, I'll go back to...
So how many people, sorry Minister, in the interest of time, I've got a lot of questions I need to get through. If we can come back to the question, how many people are going to die rather than at home where they'd rather be?
Oh, well, hang on. That is, I've got to kind of reject the premise of that question.
But Minister, if there's not enough funding there to support community palliative care,
No. Well,
that is the real life reality.
That's right. I might take up Ms Cathergy's
no, this is my time, sorry Minister.
Which is that who says there is not enough money? In fact, what has happened is that we've seen an increase in the number of community palliative care episodes. So in fact, we've exceeded our target.
Correct.
And that's meant that more people have been able to access the care that they need at home. And as we've discussed, many people express a preference to die at home, and our health service system is supported by our government with $31 billion in funding in order to meet the needs of their communities.
So community palliative care says their demand is increasing month on month. Secretary, I might go to you. The community palliative care are required to provide the department with the data that they collect on these patients, and they are saying that it's going up month on month. The increase in numbers they are dealing with, and they have reported to the department, but it appears to have not taken any of this data into consideration for budgeting purposes. So where does the data go, and what is the department doing with it, given the enormous demand that's continuing to increase?
Well, Ms Benham, the department monitors activity right across the public health system. As the Minister has said, community palliative care is continuing to be delivered, in fact, above the target set for it. We'll continue, of course, to monitor and provide advice to the Minister on all metrics, all measures across our hospital system, something that we look at really closely and will continue to do so. But I think the key point, a key point to make is that, hospital budgets have increased year on year. Really pleased to see that there's a lift in funding for all hospitals and health services coming out of the 25-26 budget, $31 billion in the Victorian public health system, at the highest level to date, and where we're seeing any performance issues or funding needs, of course we'll be bringing that advice.
So the budget though has remained static. For community palliative care, it's been $121 million for the last 3 years. Community palliative care are saying that their demand is going up month on month on month. It seems that the data that's being provided to the department is not being taken notice of because the funding is remaining static.
Who says it's static?
It's not the case that any data that the department has access to and is monitoring for performance and effectiveness right across the system, it's all taken seriously. The community palliative care is reaching more Victorians than ever before, I think is the key issue here.
That's right.
And where that data is suggesting to us that there's any need to adjust resourcing, we'll be bringing that advice to the Minister as we go forward.
Thank you, Secretary. No, I'm going to move on to elective surgery waiting lists now. Secretary, I refer to the Department Performance Statement, page 64, and the number of patients admitted from the planned surgery waiting list. Last year, the then Secretary told this committee that the department's intention was to progressively bring all planned surgery lists into the elective surgery information system. Yet data for regional hospitals such as Bairnsdale, Mildura and Wangaratta are still not included in the data. And 1 year later, we can't see these lists and get a full picture of the waiting lists across the state. So why has the government failed to do this, as indicated 12 months ago?
Well, I'll take up that question because I was here 12 months ago, and I'm really pleased to be able to advise you, Ms Benham, that indeed we are expanding the ESIS, that is the Elective Surgery Information System, project to a further 8 rural and regional health services, and indeed...
Including those 3 mentioned?
And Mildura will be one of those as well. So
when will that happen, Minister?
Yes. Well, we are expected to commence public reporting in the 25-26 financial year or earlier if possible. So this is really good for a range of reasons, as you said. So we've got that. We want to increase the transparency of our data, particularly as we continue to deliver record planned surgery in this state. In fact, we remain the only state in Victoria that still delivers 100% of Category 1 surgeries within the clinically recommended time. We're the only state that does that, Ms Benham, and I really look forward to Mildura becoming a part of our ESIS system. And one of the other reasons for that, of course, is that we're expanding our patient support units, which was an innovation delivered by the Blueprint for Surgery, Recovery and Reform, and Mildura will receive one of those as well.
Fantastic. Speaking of Mildura, Minister, are you aware of the code yellows last week?
Yes, I am.
And what immediate steps is the government going to take to relieve pressure on the services at Mildura-based public hospital?
Look, thank you for that question. For the question. So, across the system, we have seen increased demand on our emergency departments, and our government is working with each one of our health services to ensure that they are supported to respond to that record demand. And when it comes to Mildura, of course, this is a hospital that was privatised by former...
Minister, coming back to the code yellows, do you accept that a 48-hour code yellow is unacceptable?
Yes, I do. It is unacceptable to me, and that is why we're implementing a range of reforms. What's important here, Ms Benham, is that our government has in place a very concrete plan in order to address the challenges that are being experienced at some of our
Right. What is that exactly?
Well, I'll explain it to you. So we have had record demand. It's why we continue to invest in alternative pathways to an emergency department. They include a UCC, which you have one in Mildura, and I would also encourage you to inform your community that the virtual emergency department exists for them as well, because we do know that people that access the virtual, or 86% of people who have access...
But Minister, what happens to those that need to be admitted?
Well, hang on.
That's why people are waiting in that emergency route. Our bed capacity is nowhere near enough. So what's the government going to do about that? How many more code yellows will be needed?
She's answering.
If I can complete the answer, that would be appreciated. And the virtual emergency department also helps drive down presentations to our emergency departments. That means that those that are seen, we're able then to assess in a timely way their care and needs. Can I also say that here in Victoria, we're very proud of the fact that we continue to deliver care to those that need it most immediately. So the most serious people, seriously ill people or injured people arriving at an emergency department will continue to be seen immediately. Now, the issue that you talk to is about bed capacity and patient flow. And so across my department, we've done a lot of work in order to improve patient flow through our hospitals. And that's why Mildura, for instance, is a member of the Timely Emergency Care Collaborative, which is looking at ways in which we can better move people through our healthcare system. Earlier this year, I announced the standards for safe and timely ambulance and emergency care, and it's a really excellent piece of work which I recommend to you, which outlines 10 standards that are already in some of our busiest emergency departments, showing real improvement in terms of making sure that people are getting the care that they need at the right place.
It's
At the right place in the right time. Well, this is why while we'll continue to work with and support Mildura, and I might also, across a range of fronts, there's no doubt that we
Minister, in the
need
interest
to
of
deliver
time,
some support.
is there any immediate plans?
Well, yes. I'm happy to also tell you, not only is Mildura getting a patient support unit, we're also opening 4 new subacute beds this week as a consequence of some minor capital investment that our government has made, which should help improve patient flow through the emergency department. Now, but I also need to point out that I frankly have had some concerns at Mildura. It's why I appointed a delegate to the board, Ms Therese Tierney, a highly respected healthcare leader. She was initially appointed for a 3-month period, but I've decided to put her on the board for a further 12 months because I want to do everything in my power to ensure that the people of Mildura are receiving the highest quality care.
Thank you, Minister. I want to move on now to Blackburn Public Surgical Centre, and this one's for the Secretary. Does Blackburn Public Surgical Centre have 24/7 medical cover?
Ms Benham, I don't have that information available, and just see if...
Well, I can tell you a bit about Blackburn Surgical Centre. Of course, Blackburn Surgical Centre was previously owned by the Healthscope Group, and our government purchased 2 private hospitals to turn them into public surgical centres. Now, the thing about our public surgical centres is that they deal with planned surgery only. That do not do emergency surgery at all. It is to help us maintain our commitment to deliver 210,000, or help us...
Do they have 24/7
on our
health
commitment to
cover?
210,000 planned surgeries. We would need to talk to Eastern Health about the way in which they are managing Blackburn as part of their network of health services. But I can say this:
It's a yes or no question,
well,
Minister. Do they have cover?
Every health service has access to emergency care through the emergency department. Through the virtual emergency department.
So you're confirming they do?
Yeah,
There's no emergency department at the surgical...
No, that's right.
No.
But any of the clinicians have access to the virtual emergency department.
Does Blackburn Public Surgical Centre have 24/7 medical cover, yes or no?
Yes, they have on-call medical practitioners.
Okay, since the centre opened in 2022, on how many occasions has an ambulance been called to transport a post-op patient from Blackburn Public Surgical Centre to Box Hill Hospital because there was no doctor available to attend to the patient's medical needs?
I don't have that data.
Could you provide that on notice?
It may be available. I'm not sure.
Surely that data would be available.
But can I say this? That
Minister.